Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kumsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us. Hello, and welcome to another episode of Vital Conversations. I'm Carolyn Kumsty Fowler, and I am delighted today to welcome Dr. Deb Baker as our guest. Deb is the Senior Vice President for Nursing and the Chief Nursing Executive for the Johns Hopkins Health System. She partners with the chief nursing officers and leaders at Johns Hopkins Health System hospitals and outpatient care settings to ensure integration of services and alignment with the health system's strategic goals and their operational and financial objectives. She is accountable for enhancing a healthy clinical practice environment that is patient-centered with unsurpassed clinical quality and patient safety, while also providing significant contributions to education and research and ensuring nursing practice at the highest scope of licensure. Dr. Baker has also been a champion for nurse well-being, and under her leadership at the beginning of FY24, Johns Hopkins Nursing adopted a strategic priority for well-being that guides all of us across the health system. Deb, I'm so delighted you're joining us today.
Thanks for having me.
Can we start off by you telling us a little bit about how your understanding of importance of workplace well-being has changed over the many years you've been a nurse leader at Johns Hopkins?
Yes. I could say over the span of my career that nurse well-being has evolved and has become sharp focus for me, catapulted by the by the pandemic. But I think throughout my career, I've always understood that nurses want to be part of something bigger than themselves. They want to be part of a team. They want to belong and contribute to that mission in caring for patients. How that happens is something that we used to take for granted happened in one way, and that was the best way. Mm-hmm. The lessons learned since the pandemic are that our staff, by us listening to our staff, have taught us a great deal of what we can do to improve the practice environment.
I remember how many hours and hours and hours of rounding you did during the pandemic, and that's something you've continued to do to this day. Is that something that you feel really invested in?
Yes, and I have to give you a shout out here, Carolyn, because although I've always been, a visible leader, you coached me how to listen. And so many times when I was listening to staff very stressed by the pandemic that we were trying to understand every day as it was changing, I always went to fix things for them. And you taught me to listen and taught me what they were teaching me and taught me to say, what else? Instead of, this is what I can do. Because the fundamental need to be heard was so strong and so much a part of their well-being. They needed to know that we were listening, that was significant, and then that we were going to do things, and that if we couldn't fix everything, that we were going to definitely communicate to them the why we couldn't and when we could, the plan. That was so important to staff. Again, it's that sense of belonging to a group, belonging to a team, but also belonging to the strategy, belonging to the bumps and the warts. They want to know it all. And that level of transparency really needed to happen. So it was a significant lesson learned from the pandemic.
One of the things I respect so much about your approach to well-being is that you stay focused on belonging. You've stayed focused on making sure that our nurses have access to the mental and emotional support that they need and the well-being resources. And yet you've kept your eye very firmly in the space of how do we change the nature of the work itself? Like, how do we think about what operational things are either supporting a nurse's well-being or compromises a nurse's well-being. Can you say a little bit more about why that is such a priority for you?
Yes, thank you for mentioning that because I think it's significant. You know, it's like the metaphor of building house on sand, right? So there's probably not an executive in the country running a hospital that hasn't put in programming since the pandemic. And what I mean by that is, intentional use of resources to provide respite rooms, um, counseling, and just other programs that help people cope. And these things are important and they need to be present. However, they're not effective if the day-to-day operational challenges are not dealt with. And that's what I learned from the listening sessions that we did. And we also asked staff to bring their solutions. We know that high reliability component of listening to grassroots, and that the experts are the people that do the work every day. That kind of cusp approach was really, really important here because they were going to tell us what they needed. And some of these things seem so routine and not such a big deal, but they're huge. And it's about having supplies that you need to care for your patients. That the team shows up, right? It's not just the nurse bringing the iPad into the room, that the whole team is going to show up and be helpful. And that, again, that if there are limits in resources or things we can't do, telling them why and then when we can do it was so critical. If we don't take care of those operational challenges, having enough staffing, having enough supplies, listening to their feedback around some broken processes, that any of the programming or the intentional well-being initiatives we put in place just would not stick. And this continues to be, a daily focus of our team at Hopkins.
And in fact, it's interesting when you said you have to think beyond the nurse to the whole team. I remember when we were wording our strategic priority for Johns Hopkins Health System, you were very clear that you didn't want the word nurse in the well-being objective. In fact, maybe I should just pause for a moment and share with the listeners what our objective is. Would that be helpful, do you think, Deb?
That would be great. Yes, thank you.
All right. So our strategic priority for well-being at Johns Hopkins Health System is to invest in best evidence strategies to foster a positive practice environment that supports well-being and professional fulfillment. So two things perhaps we can talk about, Deb. One, the focus on practice environment is the primary goal, the positive practice environment. And the other, that we chose not to talk about improving nurse well-being, but well-being and professional fulfillment in general in our health system.
Yes, we work in teams. And when any part of that team is struggling, the entire team struggles. And nurses traditionally have provided voice for patients, for families, but also for the rest of the team. So we thought as nurse leaders, it was really important not just to focus this objective on nursing, but on the team. And, that healthy work environment that we want to foster really has a lot to do with relationships. And those relationships within the team sometimes get stressed, especially when one team member is not able to deliver in a way to the patient that is so important, and nursing finds themselves brokering a lot of this work. So we really wanted all of our strategies to be focused on also helping the team. As a nurse executive, I can spend time with our human resources person many hours looking at how we can build pipelines for all of our frontline workers, regardless of whether they're clinical or non-clinical, because we are an ecosystem that needs to be high functioning in order to care for patients.
And ultimately, one of the biggest drivers of our well-being is that sense that we're connected to each other, that we'll be supported by each other.
Yes, those connections, I think we're getting into the area of mental health, and we're talking about that because it's not just the connections I've been talking about in order to deliver care and kind of that operational connection and that trusted relationship. They're important. But the connection that's a little deeper than that is actually more important. And that is because if I'm not doing well, I'm going to tell you. And that's where, the mental health of our teams and individuals and teams is so important. And having an environment that really says we want to know when you're not feeling okay. And we want you to tell us if you're worried about anybody on the team not feeling okay. And how can we foster that peer-to-peer connection, um, where I feel like I belong every day, that people want me here, they'll miss me if I'm not here. And then if I can't be my best self, you know, can I get the help I need? And Carolyn, I have to say the Office of Wellbeing has made so many, it's a small office, but it's made so many connections of all the ways that we can get mental health care within our hospitals. And some of that is, psychiatric care, some of that is support systems. But being able to have connections to those resources, often when people are feeling really bad is when they can't reach out. So fostering those connections and that expectation that, we will speak for ourselves and we'll speak for each other is really important.
Mhm. And I remember us having conversations earlier on about the importance of saying to people, it's okay to not be okay. What it's not okay is to keep it quiet and to feel shame about that. It's okay to say, I need some support to be my best professional self.
Yeah, and I think that requires a fair amount of willingness to be vulnerable by leaders.
Mm.
And it's tough, right? We're like we're very high risk industries. We have to have high standards and have a high, have strong accountability models. Um, but I really do see part of that structure and process that we put in place as leaders to help our teams do their work is to let them know that we know that they're going to have bad days and that we are going to make mistakes and that we're vulnerable. And I try as best as I can. I tend to have a pretty strong personality and my low voice and everything. But when I'm with teams, I always try to share vulnerable moments that I've had either in the past or currently. Um, just so just so they know, because it's all true, right? And it's that transparency, and it also gives them kind of permission to speak up when they've having a tough time, when they're feeling not prepared to do something that they know they need to do today. So I try to be mindful of that, to share that when I can.
Well, I think you've done more than just share your thoughts about it. I think you've been very intentional in your work to support leaders, both in being better at supporting their frontline staff, but also in looking after their own well-being.
Yes, and that is a daily challenge. The amount of hours that leaders need to put in to really make sure things go smoothly in a very high demanding healthcare environment. There's a lot of demand for our care. And I would say, we're about 40% there. The things that we can do um to really help there's a lot of assumptions around how we should work if we really care, and testing those assumptions, asking more questions. Why can't we job share as nurse managers? Why does the manager have to be 24/7? Why can't we share that responsibility with each other? Really, really asking those tough questions, and letting people know that you're not less than because you take breaks and you give yourself space, that you turn it off, right? And so really pushing each other to do that is so important. It's easy to slide back into that I have to do everything myself kind of mentality. So it's intentional, Carolyn. It's certainly still a journey.
Mm. One of the aspects that I think you've spent a lot of time on recently is this idea of developing the leadership behaviors that support a positive practice environment. So not the pure skills like scheduling and finance and all of those things, but those relational skills. Can you tell us a little bit more about your growing awareness of why that had to be addressed?
Yes, I think it's in that category of we work from assumptions often, And we need to question those assumptions. We have to be curious. And, you know, being able to say, I don't know something is not easy in healthcare. And one of the things that it's always so humbling to me that small conversations can create big things. And we have a group that meets of CNOs, CNEs across the country. We meet a couple times a year, and we had this very informal discussion after a formal presentation about, you know, what are you most concerned about? And I brought up that I was most concerned about our nurse managers. I felt like, you know, the workforce was really going through a real transformation, that we were losing a lot of staff because they were rethinking whether they wanted to be in healthcare. And it just was just very hard to be in healthcare. And the nurse managers have always borne the brunt of any turnover in their areas. And they have a high accountability role with not as much authority as I like for them to have. So I know they're just so at risk for, you know, mental health issues and just burnout. So in that discussion, the Health Management Academy actually listened very carefully to us having this informal chat and built a whole program around this, really a research program around, you know, how can we help nurse managers? And in so doing, these young researchers found that there really wasn't much published, anything around span of control or any of just the fundamental things about a nurse manager and what they do. It was really a see one, do one, teach one. Big, you know, a lot of need for research, evidence-based understanding of what nurse managers do and how they do it across the country, and then how can hospitals support them. So we've been at this work for about 5 years, and it has been incredibly exciting. We actually have done it from the vantage point of listening to our nurse managers. We've had nurse manager cohorts from across the country come together. They have really loved the networking and just the validation of their experience. But we've learned a lot about what we can do to help support them. And some of it really was giving them the skills and exposure to a lot of why things happen in a hospital and how they happen, as well as their ability to be able to manipulate the things that are in their scope and in their purview. So it's been a very exciting thing to do. And it really has demonstrated that if we can assist our nurse managers to have that voice, to have that agency over their practice, if you will, we can create a healthy work environment for many, including those that they report to.
I remember during the pandemic, I did a lot of listening sessions as part of our crisis leadership training that we were doing around the health system. And the thing that struck me there was how many managers said to us that the hardest thing they were experiencing during those early days, that first summer of the pandemic, was how much listening they had to do to pain and how much listening they had to do to people who were stressed. And people actually they were describing sort of the technical stresses of leading during the pandemic. But the thing that was getting to them was that sense that they either didn't have the time to listen as much as they needed to, or they didn't have the skills to listen appropriately. And you've continued to focus on that. You've continued to focus on these relational competencies.
Yes. And another lesson learned is that these are not soft skills. These are fundamental skills. And it's the old metaphor about putting the oxygen mask on. You know, if we don't help managers to help their staff, then we are creating a cascade of issues that are very problematic. And I agree with you. I think our managers were traumatized by a lot that they had to listen to from their staff, because their staff were caring for people at home. They were homeschooling their kids, and they were trying to be available in a 24/7 environment. So the managers were just absorbing all this stress. And by giving them the skills and some of the work that you and I have done together, I think, a really good example is understanding. And again, this is a work in progress. We certainly have not checked anything off the list. Like how to have compassion and accountability is really critical, because during the pandemic, we had so many different people working for us coming from contracts and flexible staffing models, that the managers kind of lost their core team. And that's where the trust is, right? So they became hyper vigilant and less trusting of people's competencies and of their own. So, how can we help them restore their expectations, their high quality standards, without feeling that they're overstressing their staff? And it really was a paradigm shift for me as well, to think that by not holding people accountable, we weren't giving them the agency to have purview over to have control over their practice. And that was a very big mind shift. We were walking on eggs and so worried about not having enough staff that we weren't really focusing on the quality of leadership that we were providing in terms of holding people accountable and creating an opportunity then to be proud of their practice, to belong to something bigger. So these were lessons learned, and again, this is the work of every day that we're doing now. And I'm sure this time next year we would have learned more about it.
Mm. And I think that's why one of the decisions that we made as at the CNO Council was that we would not have a separate standalone well-being committee for the health system, that we decided to put the charge for thinking about well-being in the health system into our practice councils, to really connect those dots between, if we're investing in positive practice environment, we'll get better well-being, but we'll also get better patient care. We'll get higher levels of engagement and higher levels of satisfaction, both in our patients, but also in our nursing staff.
Yes, I mean, and I think that that's so critical when you separate well-being as into a committee or a separate priority or structure. Then you're saying it's kind of a nice thing to do, as opposed to saying it's critical to everything we do. And that people don't listen to what we say. That if we're real influencers, whether we're in an executive role or just a really excellent clinician that has influence over less experienced clinicians, then people are looking at what we do, and that's our practice. So we can't be grumpy till 10 a.m. and not be inclusive, but we're so clinically skilled that people put up with it. Those days are gone. We have to model well-being. And just a really quick example is about a year ago, I was rounding on an oncology unit. And I remember I would ask about breaks, and not just did you have lunch, like did you eat through charting? Did you really get off the unit and have a break? And there were a couple veteran nurses with some very new nurses in the station. And the veteran nurses were a little offended with me, and they said, Dr. Baker, no one needs to tell me when to take a break. I know when to take a break. And if I need to do anything, I have people that will back me up, which is awesome, right? They have trust in their team and could shout out if they needed anything. And I'm looking at these new graduates, and I said to the veteran nurse, I said, do you think that they take a break if they see you not taking a break? And she thought about it and said, oh, I didn't think about that. I've worked all these years to have these relationships where I can do what I need to do for me and give a shout out, but I guess I'm not explaining that to the people that are coming along. And it's exactly right. Like, those new graduates were not getting lunch. They weren't taking lunch, or they were eating your lunch while they were charting, because their preceptor didn't do that. So I think that really, in a nutshell, says it all, that we have to practice well-being, or it's just not going to stick. There's not going to be any stickiness to that kind of healthy work environment.
Mm. That was what was really interesting to me when you asked me to do that assessment around the health system. And I talked to nurse leaders, in fact, interprofessional leaders, about how we influence well-being. And what was really striking to me was two things. The first was that I think they didn't fully understand how much power they had to influence well-being. I mean, for better or for worse. And they also didn't really understand that we organize well-being, we influence well-being by taking care of the practice of nursing, of the business of nursing. I think so many people, there were only about 2 or 3 people of the 50 something I interviewed, who realized that when we take care of the practice and the business of nursing, we also take care of well-being. It was a fascinating revelation that we had neither of us had thought about, I think.
That's exactly right. And, just how we started off this podcast, when you asked me, what's different, that's what was different, right? And it was through your assessment. And we were grateful for that survey because it just keeps teaching us, right? We're still using it. Um, because again, we made assumptions. And then I realized and listening to staff, there's a lot we as CNOs for the Johns Hopkins Health System did not know or appreciate. And we needed a structured survey. And your expertise actually to, as a qualitative researcher to explain that to us. And then as a group, prioritize, what we need to do first, second, and third. And what was very significant was that realization that, boy, what I do every day and how hard it is or how easy it is to accomplish that is fundamental to my well-being.
Mm. Perhaps as we begin to wrap up, can I just ask you to reflect for a couple of minutes on how we make the business case for investing in nursing well-being when we have so many competing financial priorities?
Yeah, that's an excellent question. I really think it's the long game, if you will. And that's, as executives, that's what we have to be able to articulate and in dollars and cents. So an investment in well-being today can pay huge dividends over time. And really, you don't have to wait too long to be able to realize those successes. And we are fortunate. We have chief financial officers that also understand operations. And in healthcare, operations are a little messier because we have a very diverse workforce with a wide range of preparation and training and practice. So, being able to explain that, what does that mean? And what it means is that you have to invest in the early part of people's careers in order for them to have self-agency. And when they do, and they feel it, and they know that you care because you're investing, you're asking the questions, you're asking where do they want to be in a year or 2 years, and what tools do you need to be able to get there successfully, then you're investing in retention. And the one thing that is really important, and many people understand, is that retention of talent really is an investment. And if you can't do it, it's a huge expense. So I always start there. Many CNOs across the country do this. But we also have to be able to challenge the way we deliver care. In some of our models, we've been doing it the same way for a very long time. So that's how you build the trust with the rest of the executive team, especially when everyone's under financial pressure, to say, well, this is what we can do differently because we want to invest in wellness, because we want to add that resource nurse at night shift with the staff that are less experienced, so they're not so anxious. So it's always a compromise, it's a give and take. But there are certain things, and we've adopted this language around our financial planning here that are the non-negotiables, right? And I really think investing in well-being of our staff, really having their up, and at Hopkins, it really is around our professional governance model, right? And our shared governance model, having those listening sessions and having people's voice count and how it impacts our decisions is really fundamental to that. And that is an investment. That's a financial investment to give people time to do that. And I'm very well aware of that. So it's important. My job as an executive is to really be able to detail and itemize the things that we're doing and the retention that we're really seeing, and we are seeing it. So it's exciting. It's exciting to invest in something and then see that retention of staff that want to be part of the mission.
Right. And I'm going to ask you one very last quick question, Deb. And that is, if you were meeting with CNOs around the country and they would say, Deb, why go to the extent of having a system level strategic priority about well-being for nursing? What would you say to them?
I would say to them much of what we've been talking about over the last 30 minutes, and that is having it as a strategic priority keeps it in focus. And again, keeps us disciplined to make sure that we incorporate well-being into all of our strategic priorities and that we invest in it. And when you don't have it as a strategic priority, then it does slip down to the bottom of the list of focus. And I also think a little part about keeping it as a strategic priority is that we're still learning. We're still learning from our staff what we need to do, what we need to pivot, what we need to invest in. And we have a long way to go with that. So I think it needs to stay a strategic priority and probably part of our mission.
Thank you so much, Deb. And in saying goodbye to you, I also wanted to just publicly acknowledge you both for your leadership in this space, but also for your incredible partnership that you've shown the Office of Wellbeing and Wellbeing colleagues in general across the health system. So thank you for that, Deb.
Thank you, Carolyn, for everything you've taught me and the small team in the Office of Wellbeing that, this work that we're doing, we're not providing people soft skills. We're actually providing them survival skills and ways to thrive, not just survive, but thrive in healthcare and deliver the best care we can. So thank you for your partnership.
Thank you. And thank you, everyone, for listening to our podcast. And we hope that you can take away some of the insights that Deb shared today as we focus on how do we have our workforce thrive at work. So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.